Morning everyone, I am Simone Rendon, BSN 1N. I'm going to present about oral care and its rationale. So first thing first, we are gonna wash our hands. It is to prevent the spread of microorganisms. Step number 2, gather equipment for demonstration. It is to save time and energy. Number 3, provide privacy. It is for client comfort and privacy. Step number 4, place client in a fowler position to position patient for oral care. Next, wash hand and apply gloves to sanitize hands before oral care. Next, arrange articles within client reach for the client's convenience. Number 7, assist client flossing and brushing as necessary. Position mirror, MSS basin and water with straw near the client and a towel across the chest. It is to provide a smoother procedure for the client. Number 8, assist client with rinsing mop. It is to help client facilitate proper rinsing. Number 9, to position client for side rails and place ball button within which it is to ensure client safety. Number 10, assist client to the high fowler position to avoid difficulty while doing the procedure. Number 11, wash hand and apply gloves to prevent the transmission of the pathogen. Number 12, assist client with denture removal with tissue. Grabs tap denture with numb and forefinger and pull downward. It is to properly remove the client's denture. Number 13, place the denture cup. It is to avoid contamination. Number 14, place thumb on the gums and release the bottom denture. Grabs denture and thumb the forefinger and pull upward. It is to remove bottom denture without touching the lips. Number 15, place in denture top to prevent from contamination. 16, apply toothpaste to brush and wash denture either with cool water in the MSS basin or under running water. In the sink, pipe sink with towel to protect denture in case they are dry. It is to prevent the build-up of plague and food particles with dentures. Number 17, rinse thoroughly. It is to remove excess pathogen. Number 18, assist client with the rinsing mount and replacing denture. It is to ensure properly rinsing and replacing dentures. Number 19, to position client with side wheels up and call button within which it is to prepare clients for aftercare. Number 20, position client as condition allows, high fowlers or lateral position, head turned towards side. It is to properly execute for oral care. Number 21, place towel across client chest or under face and mouth if head is turned to one side to prevent the water from going to the client's body. Number 22, moisten toothbrush. Apply small amount of toothpaste and brush teeth and gums. It is to remove easily the pathogens in the mouth. Number 23, rubs the dental floss in both hands and use floss holder and floss between all the teeth, holding floss against tooth while moving floss up and down side of teeth. It is to utilize the dental floss in cleaning the oral cavity in all areas of the teeth. Number 24, assist the client in rinsing mouth to wash out the pathogens. Number 25, reapply toothpaste and brush the teeth and gums using friction in a vertical or circular motion. Hold brush at 45-degree angle against teeth and brush from surface to crowns of teeth. On the biting surface, move brush back and forth in short stroke. All surfaces of teeth should be brushed from every angle. It is to circular technique, remove the plague and cleanse under the original margin to avoid missing spots. 26, assist client in rinsing and drying mouth. It is to ensure proper cleansing. Apply lip and moisturizer if appropriate to avoid dryness and chop in the lips. 28, Reposition client side rails and place call button within edge to ensure client safety. Number 29. Provide privacy to ensure and safety of the client. Number 30. Wash hands and apply gloves. It is to prevent spread of infectious agents. 31. Explain the procedure to the client to promote cooperation. 32. Place the client in lateral position, head turned towards side. To execute procedure properly. 33. Use a floss holder and floss between all teeth to get rid of pathogen that build up. Number 34. Moisten toothbrush and brush the teeth and gums using friction in a vertical or circular motion. Do not use toothpaste on inner or outer surface of the teeth. Hold toothbrush at 45-degree angle against teeth and brush them from sulcus to crowns of teeth. When biting on surface, move brush back and forth in short stroke. All surfaces of teeth should be brushed from every angle. It is to avoid harming the gums and to remove the plaque in the mouth. Number 35. After flossing and brushing, rinse mouth with an acetylacetone and perform oral suction to remove debris and water out from the mouth. 56. Dry the client's mouth. Prevents water from dripping. 57. Apply lip moisturizer to prevent chafe and dryness. 38. Leave the client in a lateral position with a hand slide for 30 to 60 after oral hygiene care. Suction one more time. Remove the towel from under the client's mouth and face. It is to remove debris and water from the mouth. 39. Dispose any contaminated items in a biohazard bag. To dispose any contaminated items to free from infection. Number 40. Aftercare. To return all the materials. 41. Remove gloves. To remove any disposed gloves. 2. Wash hands to prevent contamination. 3. Document care for the future reference. 44. Accept constructive suggestions and criticism to be more knowledgeable and learn from their mistake. 45. Assumes accountability to be more responsible of their action. Thank you very much. Good morning everyone, this is Simone Rendon and I am going to tell you about the procedure and its rationale about offering a urinal. First things first, you are gonna to prepare materials. It is to save time and energy. Do hand hygiene or hand washing and put on gloves after drying. It is to prevent and control transmission of infectious agents. Number 3. Provide privacy. It is to provide patients comfort. 4. Explain to the patient about the procedure. It is to elicit cooperation of patient. Determine if the patient needs help in urinating. It is to promote independence. 6. Assist the patient in a comfortable position. It is to maintain safely. 7. If the patient needs assistance, hold the urinal for them. Position the urinal properly and gently. If assisting a female, help the patient spread their legs and cover for privacy. If you are assisting a male, put the penis in the opening of the top of the urinal and cover for privacy. It is to help patient urinate properly. 8. When the patient is done urinating, carefully remove the urinal. It is to avoid spillage of urine. 9. Do perineal care. Use the washcloth or wet wipes for women to be sure to wipe front of the back. Put new gloves if so to prevent and control the transmission of infectious agents. 11. Dry the area between the patient's legs. It is to avoid irritability of the patient. Number 12. Analyze and measure the patient's urine output. It is to monitor patient status. 13. Empty the urinal into the toilet. It is to prevent the spread of pathogen. 14. Rinse and wash the urinal using disinfectant diluted with water. Dry the urinal or let it air dry. It is to remove pathogen that inhibits the urinal. To prepare for the next use. 17. Take off your gloves and dispose it properly. It is to avoid contamination. 18. Assist patient to do hand hygiene. It is to prevent and contain transmission of pathogen. 12. 19. Aftercare, it is to return all the equipments utilized. Documented, it is to provide data and coordination of care. 12. Accept constructive suggestion and criticism to improve and develop skills. 23. Assumes accountability to understand and accept consequence of action. Thank you very much. Everyone, this is Simon Russell Rendon, and I am going to introduce and do the BedBath. So what is BedBath? Basically, BedBath means bathing a patient who is confined to bed and cannot have a physical and mental capability of self-bathing, but is an act of cleaning the body. Baths are given for therapeutic purposes. Purpose of bed bath is it can help your skin healthy, control odor, and increase comfort.